Welcome to another episode of Well-Adjusted Mama. This is a podcast dedicated to educating and empowering women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton. I'm a maternity pediatric chiropractor, functional medicine practitioner, and mother who has hand-selected experts in natural holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. Today, I had the pleasure of interviewing a longtime friend and colleague of mine, Dr. Radhika Kapoor, and we focused on her area of expertise, how to develop a healthy pediatric airway and why it's important. Dr. Radhika Kapoor was born in New York City and raised in New Jersey. She has extensive experience and sincerity to pediatric oral health care. She's passionate about working with children and their families in a fun and gentle manner. Furthermore, Dr. Kapoor's strong educational foundation allows her to share a wealth of knowledge of oral health as it relates to overall wellness. Dr. Kapoor earned her Bachelor of Arts degree in psychology, focusing on areas of child development at Barnard College, Columbia University, where she truly refined her education of child behavior and anxiety-reducing techniques. She then continued at Columbia University to receive her Doctor of Dental Surgery degree. While at Columbia, she held leadership positions with the AAPD and Give Kids a Smile. She received numerous academic honors and was published in the New York State Dental Journal for her work on ectodermal dysplasia. Her passion for children's dental health and community service was further solidified during her volunteer work, including a mission to Dominican Republic. She had the privilege of completing her pediatric dental residency training at well-renowned Children's National Medical Center in Washington, D.C., where she received extensive training and experience in treating patients with special health care needs, sedation, trauma, general anesthesia, and interceptive orthodontics. Inspired by her own personal struggles with nursing an infant with posterior tongue tie, Dr. Kapoor sought to enhance her training in CO2 soft tissue laser to help with speech, feeding, and airway issues in toddlers and adult postural sleep problems. To find out more, you can check out her website at HobokenSmileSpecialist.com with her practice, Smile Wellness. Hi, Dr. Kapoor. Welcome to the show. I'm very excited to have you on today.
Thank you so much. I'm so excited to be here.
So we've known each other for a long time and have cared for each other's family members and each other. Yeah. And there's been a big evolution that's occurred, I think, for both of us professionally, as we became mothers and really understood the impact of how to support a child developing an optimal airway. Even though we were pediatric specialists before we became moms, right?
Yep. Yes.
So, we're going to talk about developing a healthy pediatric airway and why it's important. I think that's almost like a duh. Like we all know how important airway is, but I don't think a lot of parents know that there is an opportunity and especially those first few years of a child's life to really use their massive growth and development to grow an optimal airway, right?
Yes, for sure. It's a unique opportunity that anyone who specializes in working with children can really optimize their overall health. And I think that, my goal is to bring at least going to a pediatric dentist visit to be a lot more than counting teeth and checking for cavities. Because we're all dealing with the same space. We're dealing with the mouth, and our biggest emphasis is how it connects to the rest of the body. And each professional in their field has a valuable moment with a child to provide insight to the parent. And I think I think that we work really well together because we feel that collaboration is key to seeing things from unique perspectives and then offering recommendations based on that, all with the goal of what's going to minimize health issues in the future, aside from typically known dental issues. So I'm excited to talk about that.
Exactly. So I think this is really a shift from a traditional pediatric dentistry approach to more of a functional approach, yes. Which to me, functional medicine and dentistry always involves a team approach. It's recognizing that we all have our different specialties, but when we're looking at optimal health, it is how do we all work together to support that individualized patient and actual needs are.
Yep, exactly.
And it is really unique, once again, working with a child versus an adult, right? Because once somebody comes even to you now, seeing people with airway issues as an adult, there's a lot more work that's required to optimize their airway, even though it's still possible, versus a child where you're working with the growth of their body.
Exactly. I think there's a lot more knowledge that needs to be shared with parents from their visits with all medical professionals. That's really where it needs to start, with pediatricians, and emphasizing what parents should understand about growth and development. Really, for me, it's only after, how many years after residency, almost a decade, where I feel like I now finally have a true understanding of what you should be seeing in a child's growth patterns with their jaws and their skull and certain things that are formally like fixed. And a large part of that is all under the age of 4. 0 to 4 is a population where I feel, we'll say 1 to 4, because I find that there's a lot of emphasis with parents understanding infancy and really understanding what's going on with our kids when it comes to what they should be monitoring. Parents are generally good about monitoring the child's feeds and wet diapers, but what starts to happen in toddlerhood is there's somehow I feel lack of knowledge of what's normal, what's less than normal, what should we look at further, and often gets dismissed as, well, this child is a 2-year-old and they should be teething, or their development is maybe not on time, but other children might be experiencing the same things. And I think that a large part of the 2 to 4-year-olds, what gets really missed at pediatric visits is, dismissing it as this is normal for kids to be going through. They're entering school, they're entering daycare. So it's normal to always have ear infections. It's normal to always be congested. It's normal for them to be drooling. And I think these are missed opportunities, because a lot of the time we're just trying to pacify or Band-Aid the situation rather than say, you know what, these ear infections were 3 in the past 3 months. Or, the drooling is not just while the child's teeth were coming in. We should start looking further. Or the posture of this child is indicating something that could be putting them at risk for, future issues. And I think that's because the conversations in these environments are too quick. And they need to be,
or really not even happening, right? Like if you're talking about a well visit or even a sick visit at a pediatrician office, and it is, let's say, ear infection related, which is one of the top reasons people bring their child to a pediatrician for a sick visit, is an earache, right? And which is typically just addressed with a prescription for an antibiotic. And we really know why that's not a good idea for the majority of earache/ear infections, right? If you're looking at a functional approach. But at the end of the day, even if it is a well visit, is the pediatrician asking about mouth breathing and maybe some of the other signs of airway compromise in their even infant or young child? So it's just kind of, I think, not part of maybe a traditional pediatric training, right? Unless they're working with somebody who is more of integrative or functional medicine minded. So that's where you and I can come in to kind of help bridge that gap and support these families with understanding that we don't want to use bandage approach for any type of health issue. And especially with children, how we can really shift how they're growing and developing. And I think also one more thing I wanted to mention is and I do hear this a lot in my office, the pediatrician said that's normal, and normal and common are not the same thing, right? So really recognizing that could be super common for children in daycare to be constantly sick, runny nose, very low grade, but pretty consistently, but that is not normal, right? That is not a normal response to our environment, right? And there's indication that child's immune system is not responding in a healthy manner. So what do we need to do to support that child's immune system? So that's really, I think, something you and I are both very passionate about. So I would like to start with the infant population. You and I both see a lot of infants having, let's say, breastfeeding, latching, feeding challenges, right? Before they even start solid foods. And we're really interested in looking at their palate development, their tongue mobility, their tethered oral tissues. So can you talk a little bit about that, and even looking at an infant's mouth, and then how we can see, okay, there's things here that could compromise airway, and what do we need to do at this age to help with the development?
Yeah, it's a great question. I love when I'm working with infants and parents. Number one question when they start off a consultation with me is, what if I don't choose to breastfeed? And we're looking at all of these things that have been referred, whether it's ties, whether it's a narrow palate, whether it's, just in general, my child seems like they have been diagnosed with reflux, and I'm starting to talk about nervous system. So I always start with this. Our majority of our growth starting in, I would say, infancy in utero is a lot of it is a head and neck area. And the predominant feature of what I'm looking at is that tongue. And that tongue is what's shaping the entire cranium. And what's really important for me to understand is, while one may not choose or opt out or is having difficulty with nursing, it's an evolutionary pattern that gets established. It's involving a method of movement of our tongue that basically is instinctual. It's in our genes, right? As a mammal species, we have to undulate our tongue. It needs to move in a certain way to create a certain function. And I think a large time parents are coming in feeling that they are, not comfortable moving forward with procedures or any kind of interventions if the only objective of that is breastfeeding, when in actuality, the tongue is what's going to shape our jaw growth. And shaping our jaws, shaping our cranium is shaping our airway, right? The roof of our mouth is the floor of our nose. And so the greater picture here for me in my evaluations is tongue posture. Where the tongue lies in the mouth basically tells the whole entire story. And while we don't have a crystal ball that can predict, okay, tightness in the body or tightness under our tongue is going to be 100% an issue in the future with speech, needing orthodontics, all of those things. There's enough research out there. There's enough literature out there to support that high palates, having tethered tissues, tongue ties, any type of restrictions in the body, they compromise your general growth and function. And so when the majority of our growth is happening under age 4, why wouldn't you want to optimize that, right? Otherwise, everything builds on breathing. Feeding builds on breathing. Speech builds on breathing. Sleep builds on that. And I think when parents start to understand that that is the foundation, and that's why we're involving different specialties to create a healthy foundation for their child, the pieces start to come together for them, that this is a bigger picture than our localized feeling of we're nursing versus bottle feeding.
Correct. So there are certainly children with ties, and unfortunately, maybe by the time you and I even see this family dyad, the mother's already given up on breastfeeding because it was so challenging. And in my opinion, she didn't get the support she needed earlier, right? Like those first few weeks are so crucial to develop a breastfeeding relationship. So now the baby might be 2, 3 months, 4 months old. The mother has discontinued breastfeeding. Her milk is dried up. And they are giving the model, and there's still challenges. The baby still might be dribbling milk while it's feeding from the bottle. It's possibly having lots of spit up, reflux symptoms, gas, colic, hiccups, right? All these digestive issues connected to still not having a good seal on that bottle, and or having a reaction to formula, right? Because the baby wasn't able to get breast milk. So we see this quite commonly. And even then, it's like, let's say the baby is, so that's another thing of like, okay, just because you're not breastfeeding doesn't mean that there's not something that we can't do to address optimal latch on a bottle. But let's say the baby appears to be feeding well in the breast and bottle, and there's ties. Then we have to look at the function versus structure, right? And it's like, well, how will this impact that palate development, like you mentioned, the base of the nose, nasal breathing? Is a child opening their mouth to breathe as an infant? And also, will there be issues with speech or solid food eating, posture, as this child's developing those first few years of life? So it's sometimes that, like you said, you don't have a crystal ball. It's hard to know,
Right.
do we need to like release these ties or not? And, but I'm sure there is some signs that we can look and see. And also I think because I do a lot of body work for these children,
Yes.
if they're plateauing with the body work,
Correct.
then we know there more intervention is necessary. And that's where the procedures to release these ties are so important.
I think it's also, exactly. I 100% couldn't agree more. I think the biggest thing is also who's evaluating. So it's one thing as a caregiver to have an understanding. Okay, I think feeding is going great. I think this, but we only have very, simplified objective measures of that. I know personally when I would take my daughter to the pediatrician, it was just height, weight, length. That's about it. And if one thing wasn't working right, the suggestions that were being made were just within the scope, and it's not the pediatrician's responsibility, in my understanding, to really know every detail. That's why specialists exist. But I think the urge here for me, and now trying to get into any kind of platform, is collaboration is so important. Referring to specialists where this has become their passion, this is what they do day in, day out, working with body workers, working with IBCLCs who truly have an understanding of the nervous system. Because a baby that seems like they're objectively growing on a curve might not be a baby that's actually thriving. They might just be surviving. And so for me, it becomes, when I have parents referred as a consultation now with all the experience, it's not so I can find a tie or diagnose a tethered tissue and then do a procedure. It's to provide the same oral exam I would do for a 1-year-old, a 2-year-old, a 3-year-old. As a pediatric dentist and an infant specialist, my understanding is of the mouth and what that entails. And so I may find tethered tissues. I may only find narrow palates. But the only way I'm going to come to my diagnosis is working with a team. So when I'm working with yourself and there's a recognition of, for example, torticollis in a baby, any kind of midline defects, any sort of, fascial tightness, nervous system dysregulation, and then I'm working with a lactation consultant simultaneously, it really allows my consultation to go that much smoother. I have a better understanding of the full picture, but then it also allows me to have a great treatment plan, because now the child is being treated as a whole body. That is what it involves.
It's all connected, right? So like an example in an infant, I might see an infant who is not only having feeding challenges, but they're also not tolerating tummy time well. And that could be very much tension related to, like you mentioned, torticollis, preferring looking one direction or the other. And unwinding that baby, and they're still really not wanting to do the head lifting, get that neck into extension. And then we have to say, like, how much of this is related to the oral fascial tension in the mouth and or ties. Usually they're both, right? And that's actually restricting not just the mouth and the feeding, it's restricting the entire spinal column's mobility. And therefore, if this is not addressed, it will create milestone delays. We will see that child roll later, sit later, crawl later, stand, walk later. And this is all preventable if we can work with this child at a few weeks old, even sometimes days old, versus several months to years old.
Absolutely. Agreed. And it's one of those things that, when people ask, okay, what's happening in that infant exam for you? And I'm doing the same things as I would be doing for a toddler, as an adolescent, as an adult. I'm looking at their tone. I'm looking at the space in their mouth for their tongue, and I'm looking at the mobility. And when I'm looking at these three things, it basically gives me a picture of what's going on with that child and how that will predict later on growth patterns that may either be optimal or suboptimal. And I think that's very useful information for the parents to have. I think they need to understand that while I'm very much on the fed is best, I really, a large part of what makes me happy is working with families. I've worked with you personally, trying to start a family, and there's a lot of misinformation out there. There's a lot of, information that makes you start second guessing how you are as a parent. And I think the biggest thing, my goal is performing evaluations and consultations while at the same time being empathetic to the environment in which you're trying to create this happy home and foundation without it being overwhelming. And that's only going to happen when you're informed and when you're well informed on what are the things to see, who are the people that you should create in your village as your child is growing, because this is for long term, right? The growth of that child, even if they're on the bottle, what is that doing for oral tone? What is that doing for their actual development? It's not to feel something bad about, but there's things that you can do that if you're going to just bottle feed, that you can actually do to increase the availability of movement and space. You know, I find that there's things that parents want more information on when it comes to optimizing their child's growth, and there's not a lot out there. Because it's all disconnected. I think there needs to be way more connections being made, and that's what's going to help them.
For sure. And you're really speaking to that holistic approach. Like we're not, you know, even though you're a dentist and you specialize in the mouth and I'm a chiropractor, I specialize in the spinal cranial alignment and nervous system, like it is all connected, right? And we also know that the mouth is the beginning of the gut microbiome, right? So then there's even that whole component about how to support a healthy oral microbiome and why that's so important for an infant whose gut is, every infant's gut is immature, and it takes 2-3 years for it to fully kind of mature and develop. So what can we do those first few years of life to optimize that gut development, gut microbiome? Because we know 100% that will impact that child's immune system, their absorption of nutrients, their growth, their elimination of toxins, and their susceptibility to allergies, asthma, eczema, these really common childhood conditions that are all coming from gut dysbiosis and imbalances, right? Leaky gut.
Yes.
That is so much more common than it was even just a few decades ago.
Yes.
So it's all, so like, for example, if a child is mouth breathing, that's going to impact this good bacteria in their mouth, right?
Absolutely. And I think that is it. You know, for example, when I'm seeing an infant, I cannot tell you how many infants are misdiagnosed with thrush. A large part of it ends up being related to the infant's inability to get their tongue up. Their tongue doesn't elevate. Then you add to that open mouth posture, mouth is drying out. And so now those little papilla on our tongue have these prominent white spots, and now they're being prescribed antifungals earlier, early as it can be. Or they're being misdiagnosed with reflux, similar symptoms. They're seeing the formula. They're seeing different things end up back in the mouth. And so now they're being prescribed antacids at a young age. So all of these things play into what's going on with that immature immune system, which we need to basically now counteract what they're finally breathing. So part of this apparatus that we're talking about that's used for breastfeeding or bottle feeding is to, suck, swallow, and breathe. And I think the largest part that's being missed is that word breathe. If your nasal cavity is not being developed, if it's not being stimulated with air, and instead all of that air is going straight into that baby's mouth because that child has either ties or their tone is off or their space is off, their tongue space. Now you have an open mouth posture. And so a lot of parents don't know if their infant or their child or themselves are mouth breathing. And I think that I've started calling it just open mouth postures, where you just don't have the ability to keep your mouth closed and breathe through your nose. And so in an infant, that might look like bobbing on and off the breast. And like you said, leaking out of the mouth when you're on the bottle. And a baby feels like, how can I occupy something in my mouth and breathe at the same time? No, I need to get off and take a breath. These are such important clues. So, giving the parents the tools to not only look at their infant, but themselves and their siblings in the family is so important, because that is the foundation. I just, recently went to a summit with all different medical professionals and people into functional medicine and integrative medicine. And the biggest thing that was being discussed was on gut health and immune system. And a big question people ask me is like, this tongue tie, it is so, it's feeling like it's a fad. A lot of people keep talking about it. And I say, well,
it's very controversial, right?
It is. And I say, well, I would agree with the incidence of, allergies and asthma and gut dysbiosis and infertility. So how do you respond to that? And they're like, well, for us, if in our field, I feel like we're seeing a large part of that, or autoimmune. That's another word that comes up, and you'll see big pharma and big commercials about all these things. And what does it all come down to? Gut health. And a lot of people that I meet are very much, they resonate with that. They understand that. But I think what's happening with the tongue tie world is there sometimes is an over diagnosis that's occurring, because if you tend to think that only one source can be the cause of all of these problems, then you're missing the whole big picture. And then on top of that, you need to know what's within your scope. And so for me, it's imperative that if someone's coming to me at this point to have an evaluation for their infant, they must have, unless there's some sort of financial constraints and they're just depending on how they came to my office, they must have the trifecta in their team: a body worker, a feeding specialist, someone who's actually been able to see this baby in their own environment to feed, and then myself, because I feel like that is what's going to allow for an accurate evaluation, accurate diagnosis. I think someone looking in the mouth, going on social media, looking at a picture, maybe going to a professional, depending on their level of experience, and saying they're tied and getting same-day treatment might lead to that controversy, but just like anything. So for me,
it's incomplete, right? Just cutting the tie. I know you are very passionate about this. Anybody who just gets the ties cut on their infant or even child without the other parts of the team are really missing the bigger picture. And you can never get optimal results if you only do one piece.
No, and you're not, and then anyone, I also find it now with all of and I know we're going to get there, but what is this big picture, right? Parents love to ask me, like, well, what is this going to look like later on? I was like, well, speaking of which, I want you to stay with me later on, whether it's virtually or in person, because we need to continue working on that tone. I mean, you know this better than anyone in terms of sutural growth, promoting the actual cranial growth. It doesn't just take having a tongue that's now mobile. We went back to tone and space. And if you're predisposed genetically to just have a narrow palate, a lot of parents are saying, well, after I got the ties released, I feel like the roof of the mouth was still really, really small. Well, that could be genetics. That can be environment. Mouth breathing can still be happening. Have we looked at allergens in the home? Are we looking at, other factors that can be, have these recently started daycare? I mean, I see this a lot where I saw an infant years ago, and then at 1 year old, they started daycare. And it's almost like we're going backwards in a sense when it comes to breathing patterns. And I think it's so important that the professionals, that the parents at least, understand that these professionals should be used as part of their healthcare village in the long term, to keep giving them the tools that they need to continue optimizing those growth, especially if it could be between that age 1 to 4, because now what we're trying to make sure is the child's meeting milestones, as you said, in an optimal way. A lot of parents will say, my child eats well, or they speak well. And then, I am not a, speech language pathologist or a myofunctional therapist, but I work with enough oral motor therapists to now understand what is suboptimal when it comes to eating and speaking, and when I highlight to the parents during these toddler exams, it's not normal to be that messy or hold food. It is not within normal for a child to gag on every texture that is just harder. And a lot of my infant exams just happen to be with older siblings in the room, just with the nature of the area that we're in, et cetera. And parents find this to be so useful because they now can understand kind of big picture. What does this look like zoomed out? An infant having digestive issues, an infant having issues on the bottle, or being inefficient, or having shorter feeds, or being restless when they sleep, or not growing and plateauing, as you said, can mean the very same thing in toddler form, in older child form, and adult form. And once you start seeing that this is almost genetic in nature as a species, as there's so many books out there, as a species, our jaws have gotten smaller, our tongues don't have places to go other than the airway. And this is a product of our environment and the foods that we eat.
Epigenetics, yes.
Epigenetics. That's when parents start to say, okay, just like everything else has been increasing in incidence due to the environment and the food, this makes a lot of sense, you know?
Yes, it does. And so we are seeing some of these like almost backward evolutionary changes, like you mentioned. But, we can be mindful as parents that we can make different food choices for our child.
Yes.
And, we can do our best to help have a toxin-free home, right? I mean, it's hard work. The modern lifestyle does not support health and development and growth. It's like, we have to counteract it on a regular basis.
Happy medium, guilt-free, judgment-free is what I tell the parents. We do our very best.
Yes, we do our best. And we can only really do our best if we're informed, like you mentioned, educated, empowered as parents. Ideally, this is something I'm so passionate about, is this starts preconception, right? Yes. But obviously, if you have already pregnant and you've already given birth, then you start wherever you're at. But the more we can just have this lifestyle that is creating and growing a healthy child, there's a lot we can do mindfully to use different cleaning products in our home and different personal care products and even toothpaste, avoiding fluorinated water, right? For decades, they're like, we need fluoride in our water to grow healthy teeth. Well, it's actually a neurotoxin. So maybe we don't want to put that inside our body, right? Maybe we don't want to put an amalgam in our mouth that's, has mercury in it, and mercury vapors are released every time we eat and drink. So, I mean, there's, these types of shifts that once we know better, we have to do better. And once you know, you can't not know.
Yeah. And I think that's a great, lead into how when parents are like, we want to do the least invasive thing for our baby. And for me, the biggest thing is when I'm doing dental visits on older children and almost reevaluating as I've progressed through my own career, these kids that I used to see years ago, and now looking at them from a completely different perspective as to, wow, I really feel like because of the way your mouth is shaped and the growth pattern that you've had and the way you've been breathing, how you swallow, where your tongue is, it has put you more at higher risk to develop dental decay and all of these things as to why we've had to do interventions in the past. And so while one may look at doing an infant frenectomy, like a procedure on an infant so early on in life, as invasive, I tend to find it, depending on, everyone has a different perspective really, but because of technique, because of how, we're doing this in a collaborative manner, we're emphasizing body work, I find it to be the least invasive because we're not putting any medication in the body. We're not giving anything to this child. We're basically just trying to elongate fascia. We're trying to create room. We're trying to optimize growth. And the biggest thing we're trying to do is get this child to be a nasal breather. We know that epigenetics has produced small airways, and anything that's going to optimize airway growth is going to create a healthy pattern. So even if that child and that person is in that modern world, and they are eating things that are processed, and they are eating things at school, and you don't have control of everything, how much better is that when your apparatus and your anatomy is structured in a way to support what you're eating? And that starts with breathing. And I tell all the parents that, yes, I wish I could have my kids at home all day and away from all of that, but I can't. And neither am I, subscribing to that. But I do know that we can modify, that we can limit our exposures and minimize interventions if you have almost like a checklist for your body. And the biggest thing that people ask me is about nasal breathing. All of a sudden, there's all of these questions of, I had a parent come in and they said, have you heard of this myo tape or this VO tape? And I put it on my mouth because I feel like I don't sleep very well. And I want to try it out. And I slept so great. And I said, well, what do you think that tells you? He's like, I probably don't sleep with my mouth closed. And I was like, and then what does that mean? He's like, well, then I'm not getting the best sleep. It tells you that your brain is not getting the oxygen that it needs to go through those sleep cycles to have quality sleep. Now, this is in your 30 to 40s. What do you think is going to happen from your 40 to your 50s and then your 50 to 60s? He's like, well, it's probably going to put undue stress on other parts of my body. And I'm like, bingo. That is
It's going to shave about 8 years off of your life. Like, You're going to die of a heart attack in the middle of your sleep. This is a real thing, right? And so, and once again, anybody with, now that's an adult, they didn't just wake up one day with a compromised airway. This is lifelong. I mean, unless you had a trauma, deviated your septum, and that wasn't corrected, maybe it's something that was not since you were a little child. But for most people, I'm assuming they never really had an optimal nasal airway, and that's really created this stress on their systems. I do want to talk a little bit about compromised airway in a toddler and child, and what type of symptoms that parents can look for that could indicate that they need help with their airway development. Now they're no longer an infant. And what would you do as a breathing specialist to help that child work with optimizing their development?
We'll say a big one that gets dismissed a lot is teeth grinding. Is the scientific or technical word to describe teeth grinding. My child makes these weird sounds at night. I don't know what those are. And while it could be while your teeth are coming in, oftentimes it's indicating that your child is not happy with the position of the tongue in their airway. And so then they reposition their jaws to make themselves more comfortable. And so teeth grinding, behavior issues during the day, bedwetting, headaches, misdiagnosis of ADHD, the list can go on and on. I have getting sick a lot, allergies. I have kids come in with open mouth postures, dry nose, dry lips, and their eyes just look like they've got bags there for God knows how.
Swollen tonsils and or tonsillectomy.
Huge tonsils, huge adenoids. And so that a large part of it is when I'm doing these dental exams and lots of cavities, for example, especially in in patterns. I tend to find patterns of cavities being specific spots, hard to reach spots. Saliva's not sitting there for a while. So I feel that it's so important. Pediatricians, pediatric dentists, anyone in the pediatric space who's doing a body or oral exam and a system check has to really be understanding that these are signs, these are red flags of sleep disordered breathing, and sleep disordered breathing is a precursor on a spectrum to sleep apnea.
Right.
I find the child with a perfect airway or amount of space not having that. I don't have one person at this point, and this is not an exaggeration because I have everyone fill out a sleep breathe questionnaire in my practice for their routine dental visits, not fill out one symptom on that. There's always at least one symptom. And parents are floored that, it just makes sense to them. It makes a lot of sense as to what they're seeing. I mean, I have 8-year-olds still wetting the bed. I had a mom telling me that my child wakes up at least 4 times in the night to go to the bathroom.
Right.
Is that normal? And
no.
And I say no. And it is so important because if you don't catch it then when? So
yes.
Integrating, and it took me a while because I really wanted to find very accurate technology, but also pair with board certified sleep doctors. So we perform in our office. We do it called the Airway Workup, which basically involves a CBCT. It is a very, very important diagnostic tool. It is the most important diagnostic tool used on all of our patients, as long as it's tolerated by the child. It's a 30-second scan, minimal radiation, one time to get a
CT scan.
Yep. Mm-hmm. It's a dental CT scan because we like to make that clear because parents get worried about radiation. It is much less radiation than a medical CT scan that you would get in an operating room or in a.
And the rest of their body has lead protection.
Yep. We use all of the lead-free, aprons. But it gives you a really great visual of what's going on with their entire airway, their tonsils, their adenoids, their nasal septum, and if there's any blockages, if there is any concerns that we're trying to avoid for future dental issues. So that, along with our home sleep tests and in a team approach, we use myofunctional therapists who are highly specialized in breathing and functional evaluations of our children if we suspect not only ties, but just why is that tongue not the on and off switch that we hope it to be? What's going on? Is it not coordinated enough? Is it not strong enough? Is it not mobile enough? So these are the factors. If we remember that the tongue is the on and off switch for the airway, and all of these medical professionals are looking at the same mouth, then it is important to understand that role. And once you look at it that way, then you can start making all the pieces come together to kind of come up with a comprehensive plan.
Right. Thank you for explaining that. I want to backtrack just for a second. You had mentioned that one of the biggest signs in a child is teeth grinding.
Yes.
And I was hoping you could expand why teeth grinding, which I think as adults we associate with stress, right?
Right.
And unfortunately, some children are under stress. And so people might kind of dismiss it as that's a stressed child, anxiety, which is still not okay. But this is beyond a mental stress issue. This is about that child literally trying to move their jaw to open up their airway, right? So can you elaborate on that?
Yeah, I mean, really, the tongue should be sitting in the roof of the mouth when we sleep and when we swallow. And it should sit along the entire roof of the mouth. And there's innervations there, cranial nerves that sit there that help regulate our nervous system. When our tongue is not stimulating the roof of the mouth and it's basically in a low tongue posture, or it's so tight that it's moving back into our airway, that stimulation that we need to calm our nervous system down is actually now overstimulating our nervous system. We're in a fight or flight stress response. And part of that could be grinding our teeth. And so while we might be stressed from our day, more than likely it's our body, our brain is stressed from not getting enough oxygen. There's episodes happening where it's trying to almost cause micro arousals to wake yourself up by causing your body to shift and reposition the jaw so the tongue's not in the airway. So I find that to be indicative of our nervous system telling us something's off. I should be more, calm. And instead, I feel like I'm reacting to a stress response. And that stress response is basically oxygen deprivation. And I think that can sound very scary to parents, but honestly, it's, beyond the sleep test, the number one screening tool that a parent can really do for their kids, I always tell them, is go into your child's room 1.5 to 2 hours in that they've already slept, in video, record and video. You do not need any sleep lab. You do not need even the CBCT yet to get an idea as to how they are breathing. When you're seeing not only grinding of teeth, but you're seeing tossing and turning, you're seeing that they're sweating. You're seeing that they're actually actively trying to breathe. They're using muscles, in their chest, for example, accessory muscles. Their head is more upright rather than in a comfortable position. There's different signs in addition to grinding. Grinding alone is not going to say, okay, everyone who grinds their teeth definitely has a child who has sleep apnea. It's the combination of seeing different things in our children where the picture starts to add up and indicate, wow, they're at risk for this. This makes a lot of sense to me. And there's always a family history. I have been now making it my mission that every infant that I see, I screen their parents. And I can't tell you how many times the parents disclose, well, I do snore and my dad has a CPAP. And I mean, this has just been, in the past 4 months, almost every other parent has some.
And that child could be snoring, right? Which you would see on the video, 1-2 hours into them falling asleep, right? So this is not normal.
It's not normal. And it's
common.
But it's common. Exactly. And I think that's the other thing that I urge parents to do, not only when it comes to the sleep. I know we're focusing on the nighttime behaviors indicating airway, but also when they're playing. I mean, I feel like I learned a lot of this from, body workers like yourself, where it's like postures, putting yourself in certain postures so that you can optimize what you're doing, how you're working. I cannot tell you how much I look at myself and having a forward head posture my entire life and having, kind of that hunched appearance and attributing that just to, this is how I used to read books. This is how I used to watch TV. And all of it had to do with breathing. I had a deviated nasal septum. I had a hard time feeding as an infant. And it's just it's astounding to me that because our world of healthcare, especially in this country, I find is so segmented, how could we put those pieces together? You need someone to help you do that. Otherwise, if we're going to go to, one doctor who's going to check your spine, if that doctor doesn't understand how it's connected to the mouth or breathing or airway, they're just going to be focusing on that spine. Or if you go to another doctor and say, well, she's probably sitting that way because she can't see, let's go to the optometrist. Maybe she needs glasses. And so it is so common for me to see parents kind of pushed in so many different directions when if you have this basic understanding of how things are connected and the foundation of those connections is breath, right? For breath is life, then how you function will just be a layer on top of that. And so watching your kids at night, watching while they do focused activities, watching them eat is going to be all of the valuable tools that you need before you start taking them from specialist to specialist. Because now, in fact, what you've done is you've created a foundation for your specialist to give you the best care because they have the full picture.
Yeah, your history as the parent will be much more comprehensive.
Yes.
And that is, could be an aha moment for the practitioner.
Yes.
Right? Of something they maybe wouldn't have even thought to ask. But now you're sharing it like, this is what's going on with my child throughout the day, throughout the night. They have dark, bags under their eyes, right? So like these types of things that the parent knows better, that child better than anyone else, and is an advocate for that child's health. And, that history is crucially helpful for us as practitioners because it really helps us also connect some of the dots.
And it goes back to what you said, asking the right questions. For me, when I talk to you, especially with preconception, honestly, as a pediatric dentist and, just as a female going in my OBGYN, I never made the connection of pelvic floor and alignment to being able to conceive, from what my understanding is. We have this anatomy, and if the anatomy is less than optimal, that can put you at risk for having issues. However, it is never explained in that way, but based on your intake, then the questions start to form into, oh, okay, now I understand this picture because she's asking me those right questions. I think that oftentimes parents don't know what information to volunteer to what specialty because they find that it might not be related. For example, should I tell this practitioner that I grind my teeth? If they're not the dentist gave me my night guard, why would that matter? Well, let's go back to the teeth grinding. Grinding your teeth is also putting your joints at risk, right? For TMJ issues. And so, yes, it is going to be valuable information to that chiropractor because now they're going to understand that your joints, for some reason, are being stressed out. Why are they being stressed out? Because the muscles that are around those joints are not sitting where they need to. They're tighter, or they're compensating for actions where they should not be involved in certain actions, right? If you think of the tongue as the core, we were talking about the pelvic floor. I always think about the tongue as the core of the head and neck. If your tongue is not strong, if it's not mobile, it's not coordinated, well, then everything else is going to kick in, right? That's the other reason I find grinding to be a case is that your TMJ joint is feeling tension from all those other muscles compensating when your tongue is trying to move out of the way. And when that does that, it causes a lot of discomfort on your TMJ joint. And so that is why patients also grind. All of these things are very much connected. I think it's so important that practitioners who are wanting to address their patients comprehensively should be asking very similar questions and then offering their own unique perspectives on how to manage it.
So if you have a child in your practice who has been confirmed sleep disordered breathing, or just disordered breathing in general, what would you be offering to that child? What type of treatment?
Yeah, so we basically make a comprehensive plan. Part of that's going to be, we have an in-house hygienist who also performs limited myofunctional therapy. So she's going to teach a lot about nasal breathing. We basically create a nasal breathing protocol for that child. Our visits, we ask parents to bring 3 videos, playing, eating, sleeping. We provide them a lot of details as to what we're trying to see in those videos to kind of cater our treatment plan. So nasal breathing is a big one. We do some basic oral exercises also to start to create tongue tone and strength in that area. We evaluate to see if there's any tethered oral tissues, tongue tie, lip tie, cheek ties that could be contributing. Oftentimes when it's a matter of questions regarding speech or swallowing, in general, we always refer to myofunctional therapists, and we want a nice functional evaluation so that treatment plan is not just a dental treatment plan, it's a therapy treatment plan. We do measurements and photos of their palate to get an understanding if their skeletal structure puts them in an optimal direction of growth, and often it does not. So we start early orthodontics. I mean, some of my youngest patients are age 3.5, 4 years old.
For palate expansion.
And we pivot a lot. I mean, we have so many different things that we use, removable appliances, fixed appliances, all with one goal: nasal breathing, tongue up, lips closed, breathe through your nose. That is pretty much the biggest thing. And then we do notice a lot of these kids already happen to have dental decay. So our treatment plans may include working on tongue ties and treating dental decay. And then we have to think as pediatric dentists, what kind of behavior management? And so we have options in our office. Options could be, nitrous oxide if someone's looking to do this while they're just using an anxiolytic, or we have an anesthesiologist where parents feel that if they need a lot of work done, it's better for that child to be sleeping, not create oral aversions or trauma. But it really just depends on the child and their medical history. And I think those are some of the ways we treat. And then we also do work with functional pediatricians to even come up with a gut plan. What are we going to do for this child so that their gut microbiome is nice and healthy as we're trying to retrain them to breathe the right way? So that's going to promote immune health and overall sinus health. And then a little bit tidbits on just homekeeping in general, humidifiers, checking for mold, checking for any allergens in the home. And I think parents, the last one would be any habits. All of those things help paint a very clear picture for them. And now they have a foundation, a nice foundational plan. And we just go step by step. There's no particular order. Parents love to ask, for some people, we expand first, do you release a tie second? It really just depends on what's going on. Oftentimes they're already in therapy if they're being referred to me. So if they're in therapy, then we might start off releasing ties. It just really depends. And body work is a big part of that as well.
I was going to say body work, cranial work.
It's a big part of that because the biggest thing we notice is, remember, even if they're just 2 or 3 years old, they've been compensating for that much time. Those factual patterns have been established. And so in order for me to do my work, I always say I'm like the layer on top of the cake. I need foundational work to support what I'm doing with nervous system and alignment. Otherwise, I can't optimize any manipulations, right? If there's no good foundation, if you're asymmetric, if you have tightness in one part of your body, I always tell parents, what do you think the release is going to look like? What do you think the appliance is going to do? They can't fight each other. They have to work simultaneously.
It's a team approach.
Yes.
For sure. That makes so much sense. Dr. Kapoor, any last thoughts you want to share with the audience?
I think the biggest thing is be proactive. I always tell parents, trust your instinct, trust your gut. Whatever you're feeling and thinking is 100%. It's 100%. Parents really do know their kids best. I think that it could be overwhelming to go to healthcare professionals when you have all of this information and the time might be shortened or whatever the structure might be, but don't let that dishearten you. You should feel empowered to find the right people in your village. Don't let insurance dictate that. Don't let, the internet dictate that, because you really deserve it. And so does your kid. Really, those are my main things.
Well said. Thank you so much for coming on the show today.
Thank you for having me.
Well, I hope you enjoyed today's episode with Dr. Kapoor. You can really hear and feel her passion around pediatric dental health and pediatric optimal airway development. And there's so much we can do as parents when we're aware and educated about how to support our child in optimal airway, optimal feeding, speech, all the things that are related to the structures inside the mouth and the cranium and how it's all connected. So when you know more, you do better, right? So this is about finding other, if you're not in the Hoboken area and can't come see myself or Dr. Kapoor, then recognizing finding a skilled practitioner in your area to support optimal airway development in your child is so crucial because we see it linked to so many common child symptoms that are preventable. Once again, if you want to find out more about Dr. Kapoor and her practice, you can check out her website at HobokenSmileSpecialist.com.